You're very welcome to the Woman to Woman Show here on Competent Women Ireland's YouTube channel with me, Roisin the Cleric. On this video, we are talking all things relating to fertility, ovulation, optimal fertility, and the menstrual cycle and fertility awareness with Paula Kelleher, who is a Justisse-certified holistic reproductive health practitioner and fertility awareness educator. Paula specialises in teaching women the art of observing, understanding, and interpreting their fertility biomarkers, including cervical fluid, basal body temperature, VBT for short, and cervical position. Paula supports women to effectively learn to chart their menstrual cycles, offering a natural approach to contraception and conception, as well as monitoring the overall health and hormonal balance. Paula is passionate about body literacy and believes that every woman deserves to comprehend the workings of the physical body, therefore empowering women to be equipped with the knowledge to enhance their lives and make informed decisions about their reproductive health. Paula has a broad international background, having spent 11 years living and working in 4 Asian countries before returning home to Ireland in 2022. Paula, you are very, very welcome to the Competent Women Islands.
Thank you so much for having me. I'm delighted to be here with you tonight.
Oh, Paula, so am I, because we've met before and we had long, long chats, and I'm just fascinated with what you do and how you do it and why you do it. And it's all about fertility, menstrual cycle, and knowing your body. So tell us about that.
Yeah, well, I guess I found out about fertility awareness just through my own seeking to find an alternative to hormonal contraception. When I found myself in a position needing to use some sort of birth control, when I'd been on the pill first when I was about 18, I had really negative side effects like anxiety and depression and mood swings and recurring mouth ulcers and cold sores and intrusive thoughts and all sorts of really nasty side effects that you wouldn't even really consider. And then when I was a few years later looking again to find some form of contraception, I was researching my options and I decided to get a copper IUD, which is like basically an in uterine device that they insert into the uterus. And again, I had really negative side effects to that as well. Like my hair started falling out. I had cystic acne all over my face. I got really bad pain and inflammation and bloating and really nasty side effects. And when I went back to the doctor and got the IUD removed, all the side effects went away. So at that stage then I was kind of like, there must be some other option. And then a friend who had just recently started charting her cycles introduced me to the book, which is Taking Charge of Your Fertility, which is kind of like often the first book that women will encounter when they start to learn about their cycles and how to chart to avoid pregnancy naturally. So that's kind of how I got into it, and I charted my own cycles for a couple of years, and then I just really loved it. It was really just fascinated by this knowledge and this, that we were never told when we were growing up, and so many women, when they learn about fertility awareness, often it is later in life, and a lot of women's first reaction is like, why did I never know this before? So it's this really, it's really fascinating. It's really powerful information. Then I just decided that I would like to kind of pursue the deeper learning of this. And then I heard about Justisse College, and so Justisse was the first secular organization that was teaching fertility awareness. So it's a Canadian organization. So I started the Justisse program in 2020 and I graduated in 2022. So it's a 2-year full-time, very intensive program, but it was really fantastic and really kind of pivotal for my learning. So that's kind of how I ended up sort of where I am today in one aspect anyway.
I'm intrigued because I used the natural contraception. I used to know exactly when I was ovulating and the best time to get pregnant, because I had friends who used the same when growing up way back in the day. And like you, the contraceptive pill didn't agree with me,
Mm.
and then I had the coil put in, and then I was just hemorrhaging with the coil, and I had to
Mm.
go in and get it taken out,
Yeah.
and the hair loss, everything,
Mm.
and so then I used the natural contraception, and I really got to know my body, and even knowing exactly the day, that if I and the twice that I did try to get pregnant with my children, it happened, you know, and so I completely understand, and it's about really knowing your body, listening to your body, and as you say, becoming aware of your body and fertility awareness. So let's first maybe start off at the very beginning, and that would be really understanding your menstrual cycle, would it?
Yeah, for sure. So I think yeah, we always kind of when we talk about the menstrual cycle, and I think it's great that there is a lot more of a conversation around kind of women's health and reproductive health and the menstrual cycle and periods in particular. And that's really good, but I always think that there's kind of one element missing, is that we never really talk about ovulation, and actually ovulation is the focal point of the cycle. And if you don't have an ovulation, you don't have a period. So that's like really valuable information that I think a lot of women just aren't even aware of. And also, obviously, ovulation is the time when you release the egg from the ovary. And the egg will only last for about between 12 to 24 hours. So the lifespan of the egg is really, really short. But the actual fertility window is about 1 week in total, because before we ovulate, we produce cervical fluid. And cervical fluid really is the key to your fertility. And the magic of cervical fluid is that it can actually keep the sperm alive inside the body for about 5 days. So that's why we call it like about a 1 week fertile window, which includes the day of ovulation plus about 5 or 6 days before that. If you're having sex, that the sperm can stay alive in time, that it's still in the body when the egg is released. So yeah, I think that's just it's just really magical, powerful.
Amazing. To
For
me, it's like
sure.
it's the most magical thing about being a woman, I think,
Yeah,
and
it's incredible.
it's a miracle.
Hmm.
Um, and I'm going fast forward, but we're coming back again. I
Mm.
remember, when I was pregnant with my two children, especially my daughter, my first one, thinking, oh my God, there's something magical. How can the baby breathe? And and then when I gave birth, I went, oh my God, the first time, how did she breathe inside me? And it's that miracle, the miracle of life,
Absolutely.
being a woman.
Yeah, totally. Totally.
Yeah.
Yeah,
So
it's
tell us then about if you could explain then to us about, how would anybody listen to this, especially young girls, I grew up in an area where our grannies told us about the Catholic pill, the contraceptives, like my granny telling me. But so how can so where does, if a young girl or a woman who just decides she doesn't want to do the prescription contraception, how will we know if we're ovulating and when, and what is the cervical fluid? I remember that. That's how I knew I was for ovulating.
Yeah, so again, so we can never predict ovulation. So the only way that you can confirm ovulation is with your basal body temperature, the BBT. So basically, after you ovulate, that's when you start to produce progesterone. And what progesterone does is it raises your core body temperature. So after you ovulate, your temperature will rise and it will stay high for the remainder of the cycle, until, if pregnancy doesn't occur, then basically the progesterone, the kind of corpus luteum, which is the outside of the ovulated follicle that's producing the progesterone, if it doesn't get any signal that there's kind of a pregnancy growing, it just kind of withers away, and the progesterone levels drop off, and then that's what causes your period to come. So we can only expect that ovulation is coming, and that's dependent upon our cervical fluid. So again, we produce cervical fluid in the lead up to ovulation, but the only way we cannot predict when ovulation will actually happen on what day. But all we can do then is we can confirm retrospectively that ovulation has already taken place if we're taking our temperature. So again, like when you're practicing fertility awareness method, there's very systematic kind of methods and rules that you need to follow in terms of like how to observe your cervical fluid and how to take your temperature correctly and how to record it correctly and how to interpret it correctly. So, and it can be quite a lot. And again, for it to work, and particularly for it to work for contraceptive purposes, it has to be very stringent, and it has to be, you know, if you're trying to avoid pregnancy, you don't want an unintended pregnancy, you really have to be kind of take the strictest measures possible.
Yeah.
So it's really important to learn it from somebody who's qualified to teach it. And like a lot of, you know, there's a lot of apps and things now that women can use to chart their cycle. And often it's just putting in the dates of their period and maybe putting in some other symptoms. And then often with these apps, they're basically just doing working on an algorithm and a calculation of a statistical method of statistically what date, depending on the dates of your period and how long your period was, when you are likely to be ovulating. But like every woman's body is completely individualistic, and every cycle, one cycle to another is completely, can be completely different as well. So there's no way that an app can just predict when you're going to be fertile or when you're going to ovulate. So it's really about, again, having that body literacy and that awareness in yourself and being able to actually learn a systematic method of practicing fertility awareness that has its like rules and its procedures and methods that you have to follow in order to ensure the best efficacy. And it is possible to teach yourself how to do it. So again, the book that I mentioned, Taking Charge of Your Fertility, often like that will be kind of like the Bible of fertility awareness. It's also a lot of women's like first entry point to learning about fertility awareness, and it's a fantastic book. It's a fantastic resource, and a lot of women would be like, you know, could be self-taught from that. But again, in order to have the highest efficacy, and particularly if you're someone who has maybe irregular cycles, or, you know, if you have some sort of reproductive condition like PCOS, which kind of prevents you from ovulating regularly, or if you have something like endometriosis or any kind of complex or just, you know, irregular cycles, it can be even trickier. So again, being able to work with somebody who's able to kind of hold your hand and guide you through that step by step, I think is really important. Yeah.
So then it's about the temperature of your body, taking the temp. I remember my friends used to always take the temperature. I could never work around that. I just knew by the cervical fluid.
Yeah.
So just for anybody who might not go, well, what does it look like? What does it feel like? Could you describe that maybe to our viewers?
Yeah, sure. So basically the cervical fluid, again, it's produced by the cervix, no surprise there. And the cervix, for those who might know, is the kind of neck of the womb, which connects the uterus to the vagina. And inside in the cervix, there's these little kind of cervical crypts. And basically, the cervix responds to the increase in estrogen throughout the cycle. So you can say in the first half of the cycle, just after your period finishes, basically, what causes your period to come is the fact that your hormone levels, you know, your estrogen and progesterone just completely drop. And you kind of start afresh again. And then as you kind of finish your period, your estrogen levels start to rise again, and they keep increasing and increasing and increasing until they hit a certain threshold. And when it reaches a certain threshold, then that triggers another hormone, which is luteinizing hormone, or LH, to be released from the brain. And then that's what actually triggers the ovary to release the egg at ovulation. But basically in the lead up to that, so when the estrogen levels are rising, so it's also stimulating the cervix and the cervical crypts to produce the cervical mucus. And yeah, so again, it's even inside in those cervical crypts in the cervix, that's where, if the sperm is going to be stored in the body for a couple of days, like it's inside in the crypts, that the sperm will kind of hang out, sort of like a spermy hotel, you can think of it. where they're just like chilling out there for a while, like resting up until they need to like make the rest of the journey the way up the uterus and get to the fallopian tube, which is where the egg will be laying in wait for them. Yeah, so basically with cervical fluid, then we kind of divide it into two main types. So there is non-peak and peak. And basically the key thing to remember is that all cervical mucus is fluid. Sorry, not fluid, all cervical fluid is fertile. So yeah, so a lot of people, women, when they're starting to learn, they might think that like, oh, if it's non-peak, it means it's not really fertile, or you can't, it's, you know, it's not that fertile. But it's like, you can't be like a little bit pregnant or not. You're either pregnant or you're not, you know. You're not like on some sort of spectrum of pregnancy. You're either, you know, so you're either fertile or you're not, you know.
Fertile, yeah.
And obviously like the non-peak, you could, if you have to say, you could say it has less fertile properties, and peak is more fertile properties. But again, particularly when you're learning, particularly for contraceptive purposes, we treat all cervical fluid as fertile. So basically the characteristics, like you could say for non-peak, it might be kind of sticky, creamy. It doesn't stretch very much. It might just kind of sit on your finger, like kind of like a lotion or some sort of butter or something like that. But you can't really do much with it. And it's, you know, it's thick and it's probably white, maybe a bit kind of yellowish, but you see through it. Then the peak mucus then is usually quite stretchy. So it could stretch, you know, an inch or more. And often this is what you might have heard of the being compared to like the egg white characteristics. So it's see-through. See-through looks like translucent, or it might be a mixture of see-through mixed with kind of white, creamy, and it's stretchy. And yeah, so those are kind of the two major differentiations. And again, when you're learning a systematic method like the Justisse method, we have all these different kind of categorizations and classifications for the types of mucus. Like it gets really, really, really in depth. And this again is like, you know, in the early stages, there can be kind of a steep learning curve in terms of being able to interpret. And again, and like it's really, you know, valuable information to learn as well, because again, your cervical fluid is a direct representation of your estrogen levels, which is again giving you such, you know, again, when we talk about fertility, like so many women just assume like, oh, it's about if you're having a baby or not. But it's like, it's about so much more than that. And like, to be fertile is to be healthy. To, you know, if your body is, you know, if your menstrual cycle is like your fifth vital sign, like it is a reflection of your overall health. So again, if you want to, you know, if you're going to your doctor for any issues, you know, and they might tell you, oh, come on day 3 for your estrogen level check or whatever it is. But I mean, you don't even have to do that. You can tell by your cervical fluid quality and production your estrogen levels, the same way you know your progesterone levels depending on when you take your temperature. So again, like that's really crucial, really valuable, really unique information that women can have on their own health, their own cycles day to day. So it's incredibly powerful information.
It's all about going back, I think, to basics and really just listening and feeling your body, and know and understand that your body as a woman is communicating to you differently than what it would to a man. Your body's communicating to you that, you know, this miracle is happening inside you, and that if you want to get pregnant, this is the time. I often wonder, you know, has a lot of young women nowadays disconnected from listening to their bodies?
Yeah, for sure. I think that's a really nice way of putting it as well. It's like your body is communicating to you, and like we just need to learn how to listen to her, you know, and like so often we are just like totally switched off from that. But I would say as well, like again, yeah, if you can learn how to listen to your body and how to be open to that communication and to understand, because I mean, because a lot of women might see their cervical fluid, for example, and they might think that like there's something wrong with them, or they have some weird discharge, or they just don't understand it. Another common thing that happens to women is like ovulation pain. So like a
Yeah.
lot of women will get like, and I would be the same, like I would get
Yeah.
quite, not so much anymore, but definitely like a number of years ago, quite severe ovulation pain. But I would know that that's what's happening because I know where I am in my cycle. So I'm aware of that. But a lot of, like, I've heard of women ending up in the emergency room because they thought their appendix was going to burst, and it just turned out that they were just having like quite severe ovulation pain. So even that is really valuable knowledge. And as well, the thing, for a lot of women, when we talk about, periods and period positivity and stuff, and that's all well and good, but some women really do struggle, and have like, like you've had that experience, like,
Hot
it
water bottle and Padre Pio relic going up
in the prayers. Yeah.
the old-fashioned hot water bottle.
Well, the hot water bottle is key, absolutely. But even that, but a lot of women are just conditioned to believe that it's just a woman's lot is to suffer and to be in pain, and that there's nothing you can do about it. But actually, again, that is your body giving you some information. Like, it shouldn't be, and we have done this totally, we've completely normalized women suffering. We just think that that's just the way it is, but it isn't the way it is. It's actually that women's bodies aren't able to adapt to kind of the modern lifestyle and the way that, like, there's so many different factors that can affect your menstrual cycle health. It could be the food that you're eating. You may have like some allergies and sensitivities that you're not aware of that's causing these issues. Could be lack of sleep. It could be that you're not managing your stress. You could have a really severe intolerance to alcohol. You may be, there could be any number of issues that are causing these problems. And often we just think, oh, well, I'll just take, 6 Nurofen an hour and, take hot water bottle and take 3 days off work every month. Because that's just what I have to do. But again, that's if your body is screaming at you, when you're getting your period, like if your uterus is screaming at you, like you need to listen. Like there's something there that your body is trying to tell you. And again, you go to your doctor, what's your doctor going to do? Just put you on the pill or give you an IUD.
My doctor told me to get pregnant, and that would
Yeah,
cure it all.
yeah.
And it did.
And for sure, that can be like even like a short-term solution, and particularly because, but that can and does happen, like when women get pregnant, because they get such a flood and a surge of hormones, and even if they go through the pregnancy and like deliver, have a vaginal birth, like the cervix like basically regenerates itself. So in some sense, like, and I'm not saying that that's my professional advice, but it actually makes sense, and it actually can be true in some circumstances, that if when women do become pregnant, that often it can kind of cause some sort of reset, because you kind of get that flood of hormones, and even like the hormone receptors in the body, when they're kind of just, it just kind of gives her a jig up again, but again, if it's something that's kind of like food, nutrition, lifestyle, dietary related, often those issues will come back. And particularly when, I would say the majority of women, the solution they get is to just go on the pill or get an IUD, or just to shut down the cycle, basically, is what they do. And that doesn't actually solve anything. And then if she tries to come off the pill, a year or two later, it's most likely that she's just going to encounter the same issues again, particularly if she hasn't taken any other steps to address any of the other issues that are at the root cause that are causing these problems in the first place. So there's really but not every woman wants to hear, oh, you need to stop drinking coffee, or maybe you need to cut out alcohol, or maybe you need to give up the sweets. Yeah, like we don't want to hear that. Everyone just wants to think, what pill can I take? What's the quick solution? What's the thing that I can do right now? But often it's not as simple as that, and sometimes it really does take a lot of effort and a lot of work and a lot of like investment and time in yourself, and not every woman has the resources to be able to do that. So again, it's not like a judgment if a woman will take the pill, for that, like, and absolutely at certain times that might absolutely be the right thing for her to do. But again, it's probably not going to be a long-term solution. If you're really trying to kind of step back and figure out what the root cause is and how to fix that, because the pill, it doesn't fix anything. All it does is shut everything down, and probably cause more side effects and harm in the long run, even in the short run.
And it's
Yeah.
true, it's like going back to basics, as I said before, listening,
Yeah.
feeling your body,
Mhm.
understanding, and as you say, having that body awareness.
Mhm.
So, and it's really because I've often wondered how over the years women disconnected from all that and enjoying being a woman, enjoying
Mm.
the whole miracle. Oh, this is fertility. This is
Mhm.
actually this only women have this experience, and only women can experience this. And
Totally.
that joy and that miracle of life, of women creating life, women,
Mhm.
holding life within her womb and carrying life, and then giving birth. It's a magical, mystical miracle. And
Mhm.
I think every mother, when she gives birth and the baby's given, she's, my God, how did the baby breathe inside my womb? How did it live? And
Yeah.
so, and I think media and medicine have a lot to blame, in my opinion, in disconnecting that bodily, or what did you call it? Awareness. What did you call it?
Technical awareness or fertility
Technical
awareness. Yeah.
awareness. So,
Yeah.
but I think that's all coming back. I think that has sort of done its circle, and we're going back to nature and we're going back to basics. What do you think?
Yeah, totally. But I think even, it's about so much more than just like the ability to get pregnant or not get pregnant. Again, like your fertility, it's such a central part of like who you are as a
Mm.
woman. Because your personality changes throughout the cycle, your energy levels change, your confidence level changes, your sociability changes, your brain fog changes, your kind of, like you can be and again this it's about,
You
you
get
as you
spots. You get spots.
yeah, exactly, like your
Black
skin patterns
eyes,
change.
spots.
But even when you're fertile, like your boobs will get bigger, your skin will generally clear up, your hair will be shinier, because it's an evolution, it's part of the evolutionary approach, that like that's the time when you are going to look more attractive, when you feel like you're more confident, and when you want to go out more, because like you're ready, you're ready to mate essentially. So that's how it
Yeah.
works, but it gives you more confidence. And I think even if women knew, again, like how to, if women had more kind of body literacy and awareness of the cycle, and about these kind of highs and lows throughout the cycle, that you can really kind of plan your life around that as well. So if you have a job interview, and try and like kind of plan it for the week that you're fertile, or the week that your estrogen levels are higher, that you're producing cervical fluid, or if you need to ask for a raise, or if you need to do a podcast, or you need to do some public speaking engagement, or whatever the case may be, that you can kind of plan
Right.
your. Yeah, absolutely. And then like if you know that you're going to be on your period, or a couple of days before your period, and that like that that's the
Yeah.
time when you're like really incoherent, and you're just want to sleep, and you're really tired,
Emotional.
and you can't think properly, and
Don't
you're
touch
just
me. My boobs should be sore. Your
yeah, and
boobs
you're
just
like,
get so
exactly,
tender.
you're
Don't touch me.
tender. Yeah, you're tender, you maybe mood swings, whatever the case may be, that that's a time like, hey, maybe that's not the best time to go, and do some sort of intense activity, or whatever it is. So again, there's so much valuable knowledge just in terms of knowing yourself. Yeah, that like, it can be really life-changing for a lot of women, and even like creativity levels, if you're like a writer or an artist, there may be like some week and you're just like, you are on fire, and like you have so many great ideas, and you're able to just, your productivity levels are just through the roof, and you're like just doing all this stuff. And then like a week later, you might just be like, oh, I can't like think at all. And you're like, you start getting frustrated. You're like, what's wrong with me? But it's just like, it's normal. Like you're not supposed to be productive all the time. And again, if you can learn to rest when you need to rest, and then you're
Yeah.
prepared to really like take the most advantage of those times when you have the highest energy levels and you have that high creativity level, that you can really like put yourself to kind of good use at the right times. It's incredible. It's such a special gift
It is.
to know your body that intimately.
Yeah. I've
Yeah,
always been aware of my body. I
yeah,
think it's always something that, I just listened to, even as a child, I listened to. And I
yeah,
think, as well, No, years and years ago, if women used to always, if women are living together in the one, you probably know this, if you're living together, four women were living in a house together, there was always probably have this the menstrual cycle in the 1 week or the same around the same time.
Yeah. I definitely, we've heard that. I can't say that there's actually research that will back that up, but I would say it's more like lifestyle. So if women are living together and they're spending a lot of time together, they may be kind of eating together and they have kind of similar, lifestyles, and that it's just kind of natural that it might fall into that flow. But I can't say specifically if women are
Yeah.
just together that if there is,
I've noticed
not
that.
saying that it
Yeah,
isn't, but I actually don't know if there
yeah.
is.
I
But for
noticed that,
sure.
yeah, when it was through, thank God, yeah, I'm doing my, we'd all have different periods, and then all of a sudden we all had them around that
The
2 week
same
period
time.
of time.
Yeah.
And years ago, women used to, when we go back to the ancient times, women used to always go into the forest and look after one another and nurture one another whilst they had their periods. And women looked after one another. And it was a time where women really did, without this woke, fake feminism, NGO, women supporting women, which is just word salad, really, in my opinion.
Yeah.
But women really did look after one another and nurture one another. And we
Mhm.
nurture, and to me, that is what self-care is listening and feeling and that communication of your body and yourself. And then, and intuitively, then you just know instantly what your body's telling you. And to me, that's self-care. It's not like the magazines and the media would have you, oh, self-care, go for a massage, get your nails done, get
Yeah.
your hair done. It's about really connecting to your body, and that's when your intuition is
Yeah.
heightened then.
Totally. Totally. Yeah. And that's something as well, like a woman's intuition and her kind of gut feeling, I
Yeah,
think is something, it is just so, so valuable. And again, something that I think we're often told to just not pay any attention to, or that we can't trust ourselves, but absolutely you can. And there is some sort of really powerful inner knowing that we have if we could just kind of be able to tap into that.
yeah.
Yeah. Yeah.
And
Really
that's
powerful.
exactly what because what you are teaching women to do and coaching them as a practitioner women to do is to really connect to their bodies,
Mhm.
understand, and
Mhm.
that awareness of the body. That's a powerful relationship to have, and the most important relationship is to have with yourself.
Yeah, absolutely. And even, we talk a lot about, like in the kind of discourse, there's a lot of talk about mindfulness, and like it is such a mindful practice to constantly kind of, not constantly, but from time to time throughout the day to really check in with yourself and like, how do I feel? Paying attention to your emotions, paying attention to really subtle
Yeah,
shifts in your energy levels or your appetite or your sex drive, and again, like, of course, your cervical fluid, and just like taking like a couple of moments throughout the day to really just like check in with yourself, like that is a really
yeah,
powerful kind of meditative mindfulness practice. So, and again, this is one of these buzzwords that we talk about so much as well, and it's such a fantastic because again, a lot of women, when you talk about the cycle, your menstrual cycle, women just associate that with the period. So you
yeah,
just think, because the period is what you can see, right? It's the very obvious part. And it's the thing that you have to kind of do something about it to deal with. But like, again, the period is really just an afterthought,
yeah.
like
It's all
it's
happening before the period, and the period
absolutely.
is like the end of that cycle.
Yeah, exactly. So even though we start a new cycle on the first day of our periods, that's the first day of a new cycle. But really, it's basically the end of the cycle coming to an end, and then it kind of, the period starts and finishes, and then it kind of starts, all kind of gears up again. Yeah. So just to be able to kind of to step back and to connect with yourself in that way and throughout the cycle and throughout the day is really, yeah.
It's really powerful, and I think it's
Mhm.
something that is very unique to women.
Mhm.
And
Yeah.
it's something, that, I think little girls, I think it must be in absolutely the whole makeup, in the nervous system, the
Mm,
endocrine system, the
totally.
hormones that we know, and
Yeah.
and it's funny, I will have this conversation. I'm postmenopause many, many years now. God, what, like 7 years. And
Mm.
but it's bringing back all. I remember exactly the feeling when I was ovulating as the cervical fluid was working. And I used to be able to, I would know, okay, oh, I have the ovulation pains, and I go, then I would feel the fluid.
Yeah.
Oh my God, I must be ovulating today.
Yeah,
And the
for sure.
color, and then no, and I forgot all about that until I'm talking to you now.
Hmm.
I just completely forgot.
Yeah. No, it's pure magic.
Yeah.
Totally. Yeah, absolutely.
And so so how do women start? Then we've talked about this. So if a woman was listening to you, or a young teenager, or a woman looking to really reconnect to her body, and build that relationship with her body and listening, what would be maybe your first steps in that? What would you advise her to start doing?
Well, I think at the very least is to just record like when you get your period. I think that's very first step. And to kind of pay attention to the kind of volume of your menstrual flow as well, like how whether it's kind of heavy or medium or light flow, and how many days that it lasts for. So even just that kind of information at a basic level is a good place to start. And then when it comes to observing cervical fluid, so basically what we teach in the Justisse method is kind of a wiping technique with toilet paper. So it's really,
Mm.
it's
Yeah.
really simple. Like I'm talking like we're taking like you want to take it back to basics. Like this is real basic,
Yeah.
you know.
That's what I grew up with. The real, and that's again, I would go into the bathroom, wipe myself. Oh yeah.
Yeah,
Yeah.
exactly. And you observe from the toilet paper what you can see. And then again, with Justice, we have like all these, it's so nerdy, but like all these different classifications. So how to describe like how damp or moist or wet your toilet paper is after you wipe. Like yeah, it's amazing, amazing the kind of
Yeah.
conversations that we have.
Yeah.
But yeah, so again, I think again, and that's kind of that meditative practice as well when you go to the bathroom, of just being quite, yeah, just taking a few seconds to just wipe, and observe the toilet paper and just record what you see or make a mental note to record it, what you see later on. Um, so yeah, that's observing the cervical fluid. And again, like you want to start taking your temperature, that is like so simple. Just buy a thermometer. We'd often recommend like it's called a basal body thermometer. So basically it has 2 decimal places instead of just a regular digital thermometer that just has one. So it just means it's slightly more sensitive, but it's probably not even necessary, but in general would recommend that special thermometer. But again, just taking your temperature. So you want to take your temperature at basically around the same time every morning. So if you plus or minus an hour. So if you wake up at 7 o'clock every morning, then you can kind of take it between 6 and 8 in the morning. And any kind of time outside of that, then you would mark it as maybe as an accurate temperature. And yeah, just take your temperature every morning. Literally just put the thermometer in, leave it in for a couple of minutes before you turn it on so that it warms up a little bit before you just switch it on. And just record it, either get an app on your phone or use like a paper chart that just kind of has the graph and you can just plot the temperature markers on the graph. And just do that for a month. Like it's so simple. It's the first thing you do when you wake up in the morning. Before you get out of bed, before you drink any water, before you do anything like that, just wake up, put the thermometer in, record it, and then go about your day. And yeah, even do that for one cycle, plot it on a graph, and then just see, and at first maybe it doesn't make that much sense, but again, and
Yeah.
this is, it's like learning any new skill. Like it takes time to to learn how to do anything. You know, it's going to take a couple of cycles for sure until you start to kind of see patterns, until you're able to kind of figure out what you're seeing and to be able to interpret it. But again, that's why it's really helpful to work with somebody who's able to kind of guide you along the way. Yeah, and then so those are kind of the two main fertility signs. So that's our cervical fluid and our basal body temperature. But then there's also cervical position, which is an optional sign of fertility, but I, you know, find it incredibly useful. And I would know from day to day my fertility level just depending on how my cervix feels, regardless of if I was taking my temperature or if I was recording my cervical mucus. Yeah, it's like really incredible. But obviously it requires you to put your fingers inside your vagina and touch your cervix. Not every woman is like willing or able or interested in doing that, and that's totally fine. I've never had an issue with it. And yeah, so I've always done it. But yeah, so again, like the position of the cervix will change throughout the cycle. So when you're fertile, it will usually, the cervix will be kind of higher up in the vagina, so it'll be more difficult to reach. And it'll also be a lot softer. And also there's a little opening on the cervix called the os, and the os will usually be open because it's like, we call it nature's gate. So the gate is open. Yeah. And obviously the so that allows the cervical fluid to come down, and also if you're having sex, and that allows the sperm to travel up. And when so that's when you're fertile. And also, of course, when you're on your period, the cervix will open to allow the menstrual blood to flow. And then when you're not fertile, basically the cervix will kind of get become more firm. So it might feel more like the tip of your nose maybe, and the opening at the os will be closed, and the cervix position will usually be lower down in the vagina, so easier to reach. And basically during that time, inside in the cervix, so you're producing a different kind of mucus than what I referred to earlier, the peak and non-peak. It's a different kind of mucus. It's not a fertile mucus, but it basically just sticks inside in the vagina, and it just creates this kind of impenetrable barrier, which is there to kind of prevent any pathogens from entering. So it acts as like a protective barrier basically between the uterus and the vagina. So yeah, even if you're having, you know, sex when you're not fertile, like the sperm won't even be able to travel up the cervix or up the rest of the canal on their journey. And again, that's kind of, I don't know if I mentioned it earlier, but the cervical fluid, so it does allow the sperm to, it keeps the sperm alive for up to 5 days, but also it aids the sperm in getting to where it needs to go. So it also enhances the sperm mobility. So it allows the sperm to travel up the vaginal canal basically, because usually the vagina is quite a hostile environment.
You mean our bodies are hostile?
Incredibly so. Yeah, and like sperm tend to be quite fragile and sensitive, so they don't last very long outside. You know, after an ejaculation, they basically just die off within seconds or minutes. So that's why the cervical fluid is really important. It is really key for fertility because it keeps the sperm alive, it nourishes it. And it also provides a mechanism to transport the sperm from the vagina up through the cervix and up to the uterus to the fallopian tube, which is where the conception will occur. So the cervical fluid just has so many functions. Also, when a sperm is ejaculated, it's not actually capable of fertilizing an egg at that time. It has to go through this process called capacitation, which means it basically just kind of transforms the sperm to be able to fertilize an egg. So it has to go through that process in the female body before it's actually able to fertilize. And also, there's also a lot of alsos, but in an ejaculate, like I would say maybe not the majority, but at least like half of the sperm are deficient. They either have no head or no tail or two tails, or, you know, they're not quite right. That's why they have to produce so many, because a lot of them are just, they're not right. They're not produced right. So also what the cervical mucus does is it filters out any sperm that are not capable of, so it basically traps any sperm that are not capable. So it only just provides a pathway for those that are in the best condition and the best motility to be able to continue the journey. So it's like, it's incredible, like what's going on inside the body and what it takes to actually conceive and to become pregnant. Like it's, you know, it's so fascinating to think about that our body has this, you know, really kind of selective power inside that determines what goes on inside. So it's really fascinating.
I think because I knew, I haven't really, I'm saying this publicly, and it's I knew each time, the first time I wondered, my God, am I pregnant? I had this feeling inside me, Dan. It was like it was like a pulse. It's all I can describe it, a pulse. And then when I got pregnant for the second time, I knew at that moment that I had conceived.
Yeah.
And then, you know, too, we use the safe sex, you know, the kind exactly the this treatment what let's call a natural fertility and ovulation. And then the old fashioned was, if you want to get pregnant, lie with your legs in the air and things. You know, and to me, that old fashioned grandmother's tales work. And you know, and it's something, you know, I really wish that, and I do believe it's happening now. I see the change in the whole sort of feminism and womanhood and, you know, motherhood and everything. I see that all coming back, where women, young girls now are more curious about listening to their body. They're not, they've gotten over all I would say, the last 20 years of listening to the media and the magazines telling them what to do. And I notice now with young teenagers, they're more in tune to listening and feeling their body.
Yeah, for sure.
That gives me hope.
Yeah, totally. I think we are in a different age, and like, you know, this is the good thing about the information age, even though sometimes we can be so overwhelmed with information, but I do think, you know, we have so much more access to knowledge than we did before. So it's fantastic. Yeah, but also just what you said there about, you knew like the moment that you conceived and you could kind of feel this like pulse, but there is actually like, it has been recorded on camera, like the moment that fertilization occurs, there's actually like a flash of light, like it's like a flash of light.
That's exactly how
yeah, it's like I think it's like a zinc chemical reaction. So it's like the moment that conception happened, it's like this flash goes off. Like it's incredible. Like it's so beautiful to see that. Yeah.
I didn't want to say that, but that's what it's like.
That's it. Yeah. So it might sound like a bit woo-woo when women say this, but like, it's like, you know, there's something to that. Like, you know, when we talk, like, there often is things that we say are woo-woo, but like they are woo-woo because it is like, you know, there's something defy logic, or some things can't be explained, you know, and it's it's a really beautiful thing.
It was like,
it's incredible.
I knew.
Yeah, it's so good. And again, that's like,
it was like, you know, I would be impatient because a lot of my friends had trouble and they were trying and trying. I go, oh my God, don't give that, because I just wouldn't have patience. Because you know what, I just need to. So I, listening to my body, I knew, okay, it's this month. I'm going to be pregnant, and so, and then 3 days after I conceived my daughter, I knew I conceived because I had this awful morning sickness.
Oh yeah.
And I went over to the phone and I phoned my ex-husband, my husband at the time, my ex-husband now, and I phoned, go check the milk, and because he worked from home, I said, go check the milk in the fridge. It must be off, because I had sugar puffs. I loved my sugar puffs.
Sugar puffs, yeah.
It's funny how all this is coming.
And 7 years, they were real. Can you get those?
And I loved my sugar puffs. And I stayed on the phone until he went into the house and he said, it's fine. And oh my God, I must be pregnant. Go try it again. I just knew. I mean, and I'm heartbroken because I thought, oh my God. And I thought, well, do you want to be pregnant or do you want your sugar puffs?
Which is it? I know.
You know, but that is true. Yeah, I knew straight away. It was boom. And
For sure. And I mean, it makes sense that you would, because again, like that's a huge, the creation of life, that moment, like that's a huge,
mm,
connection of energy. Like, of course,
yeah,
like when that's happening, like in your body, and particularly when it's intentional, like it makes sense that you would be able to feel that. And again, I think it's back to that kind of women's intuition. I think, a lot of women maybe have some sort of sense, but they just have never kind of explored it, or
yeah.
really,
Or
or
even acknowledged it.
acknowledge it. Yeah, exactly. So yeah, it makes total sense that you would have this kind of reaction and this inner knowing to it. Yeah, it's really.
I think I might go and Google that now, see what you said.
Yeah, I can definitely find you a link
That would be lovely,
to the
wouldn't
video
it?
of that. Like, yeah, it's really
Yeah.
beautiful to watch.
Isn't it,
Yeah.
when you think about it, isn't like the miracle of life, the miracle of being a woman, the joy of being a woman. And I think for me, it's like, and this is what I love about Confident Women Ireland. It's all about celebrating being a woman. It's
Hmm.
about really empowering other women to embrace and the joy and the
Hmm.
miracle of being a woman.
Yeah, for sure. And something I really like as well, about we talk about like the kind of at the timing of conception. So
Yeah.
often, particularly in kind of media and culture, we're often like shown this idea of like the man and like the sperm as being like the fastest and the strongest and the hero and the champion and the
Women!
winner and the one who wins the race. And that's actually total nonsense. So actually how it happens is like around once the egg is ovulated, and around the egg there is this kind of radius called the zona pellucida. And basically that is like an impenetrable membrane. And it basically requires the efforts of like hundreds of sperm all trying um to fertilize the egg. And it's basically a team effort. And as they're all trying to kind of get
Oh,
in and penetrate the egg, basically it's causing like the chemical reaction that's causing the zona pellucida to break down and kind of wear away. So it's actually a group effort of all the sperm trying to get in, and then eventually like the egg will just select one, or one will just kind of break through the barrier, and that's the flash of light, and that's
it's
the
like the
moment of
aura.
conception. And then there's another chemical reaction that basically will repel all the other sperm, and then that's it, they're gone, and then that's
Wow.
it, that's the moment of conception. And that's like, and also like sperm are teeny tiny compared to the egg. Like you can actually see an egg with the naked eye. It's about the size of a full stop, whereas a sperm are just like teeny tiny, microscopic. So the egg, it's like it's the largest cell in the human body, and like we release one every month, and that is no small endeavor to release a cell that is the size of a full stop from like your internal organs. That's a huge thing. So yeah, that's just like a fact that I think is really
Yeah.
nice as well. And in
It's like
particular, they talk about like the male like champion sperm. It's like it's actually not true at all.
you think about it, it's the team effort.
Yeah.
And then you can think, well, and then it's like that light. It's like the aura and
Yes.
the soul being created.
Totally. Yeah. Totally.
So yeah, that when you think of it that way, it's definitely, the light, the soul being created, and that team effort. And you could just imagine then if you were doing the other sperms going, yay!
Yeah. Well, they don't even get a chance. They're just basically wiped out. Like they're exterminated like straight away. Before they even know what's happening, God help them. But yeah, that's
I
how it
think
happens. So
women then, when they're ovulating, I might be asking the right question or the wrong question, but I'm going to ask it anyway. What sort of self-care should a woman take when she's ovulating, and if she wants to get pregnant in that ovulation period?
yeah, well, I would say, it's kind of more taking care of yourself in the lead up to that. And again, like, giving yourself a chance to if you've been struggling with, if you're having fertility issues or conception issues, just to kind of give yourself a bit of time. to just kind of, again, look at your nutrition, look at your sleep, look at your stress levels, look at your alcohol intake. And I would always recommend like women take, and it's, and sometimes for women, I totally understand like time may not always be of the essence. But again, if you can give yourself like as much time as possible to kind of prepare your body as best you can. So again, I think it's really just about looking at like the food that you're eating, your nutritional levels, making sure you're getting the right vitamins, the nutrients that you need. And again, there's kind of only so much that you can do around the time of ovulation, and again, it does tend to be the time of the cycle where you have more energy and you're probably in a better mood, and you're more sociable and you're more feeling more kind of sensuous and you're feeling more confident. So I'd say just kind of to embrace that and to just kind of, let yourself kind of shine at those moments. But then particularly kind of in the lead up to your period, that's kind of when I would say the kind of typical like self-care in terms of get a massage or, stay in bed for an extra hour or whatever. Those kind of self-care tips are probably more
Go for
more
a
adept for
walk.
that
Go
kind
for a
of
walk.
time. It's like go for a gentle walk or whatever it is.
Spend
Yeah.
time with your other female friends.
Yes, exactly. Yeah. So do something kind of
Have
nice for
fun.
yourself. Obviously,
Laugh.
you should be doing that, all the time.
Yeah.
But again, I think the kind of needs of the cycle are going to be different. But again, every woman is different. So I would, definitely get like quite high energy when I'm fertile or when I'm, close to ovulation. But also sometimes it can be really draining because sometimes it feels like I've had 10 cups of coffee. I can be like almost like shaky because I'm kind of almost overstimulated. So they can leave me feeling like really drained and really exhausted. So again, it's not just, and for every woman, it would be quite difficult. Some
Find
women
that
might get a
balance.
burst of energy before their period. So again, it's just kind of figuring out your own body and just what you need for yourself.
And
Yeah.
you spent time in Asia. When you lived in the four countries in the Asia region? How do you find the Asian culture towards fertility and the menstrual cycle and ovulation compared to the Western society and
Mm.
culture?
Yeah, that's a good question. Well, I guess I spent the last 6 years I was in China, so I spent the longest amount of time in China. I started charting my cycles when I was living. So when I first moved abroad, I was in Thailand for a few months, and then I moved to South Korea for 2 years, and then to Japan
Wow.
for 2 years. Yeah, and then to China for 6 years. So I first started charting my cycles when I was in Japan, and then moved to China, and I was still charting when I was there. And then that's where I also did the Justisse program while I was living there. So I would say probably when I would talk about the Chinese, it would be more kind of the Chinese approach to health and fertility, which would be, I guess the Chinese would be a little bit more aware of like the kind of harm of using hormonal contraceptives. I think a lot of, here it's just kind of like a standard thing.
Yeah.
It's not, it's just, and you'll kind of do it for any reason, any and every reason a doctor would prescribe you the pill. Whereas even though you can buy it over the counter in China, I think women are a lot more kind of they're less prone to want to take some medicine or to put something in their body. Even, for example, they wouldn't really use tampons or period cup or something like that when they're menstruating. It's usually just pads because
Yeah.
the kind of Chinese philosophy of not putting any external objects inside the body.
Mhm.
So they usually just kind of use sanitary pads instead of tampons. So even that's kind of another kind of approach to it. So but I think it's definitely an issue kind of worldwide that there are kind of rising rates of infertility or couples having fertility challenges, and I would say China is no exception to that either. So I don't know, it's a good question. I'm not entirely sure the best way to answer it.
Because I've often heard, during menopause, the Japanese women have a completely different approach to menopause than what we Western women have. And I
Mhm.
always find that the different. I love so that I'm curious to find out how
Hmm.
the different cultures approach um, Mother Nature.
Hmm.
So I'm really curious about that. So you're back in Ireland, and you're a Limerick woman, are you?
Yes, that's
You're a
right.
Limerick woman.
Yeah.
And excuse me, and you're living in Limerick.
Yeah, I'm back living. I'm not at home, but I'm near home. Yeah.
Great. So how can people get in touch with you to find out more about all this wonderful um you know concept of it's not a it's a concept, and it's gone back to basics of the concept of you know fertility awareness, ovulation, and just all what we've been talking about tonight, and connecting with your body and finding out, discovering your own body when you're ovulating, the menstrual cycle, your fertility awareness. So how can they get in touch with you?
Yeah, so basically I'd say the best way to contact me is through email. So that's Fertility Awareness Revolution at outlook.com. I did have my own business for a while, and I did have my own kind of social media channels, but I kind of wound that down last year for just kind of that was the business that I started initially. So I was kind of planning to relaunch, but then my life just took a crazy spiral in some different directions. So I'm kind of just only getting back on my feet in the past couple of months. But I'm hoping to like start writing a Substack.
Yes.
Yeah, I think that's something I quite like to do. And even just doing maybe not necessarily working with clients one-on-one like I had been doing, but just doing kind of more workshops
Yes.
And kind of maybe online
And
sessions.
that's
And
fun too.
yeah,
When you have a
absolutely.
group of women getting together and sharing stories and seeing it as fun. I think
Yeah,
that's what it,
absolutely. Yeah, and that kind of
yeah,
opportunity for women just sharing space together and like
yeah,
sharing their stories and their experiences, I think is really, really valuable as well. So yeah, that's definitely the direction that I'd like to go. And I do want to start working with clients as well, but I just don't think I'm quite there yet. In terms of being ready to take on clients. But yeah, that's definitely the direction that I'm going. But I do think, yeah, I'd like to maybe write more. So I'm thinking Substack
yeah.
might be a good way to do that.
Build
And
that awareness. Build that awareness. Getting
yeah, absolutely. It's
women,
just
young
a way
girls.
of getting the kind of knowledge out there as well. So I do think like this knowledge, it's really important.
Yeah,
And there's just not that many conversations that are being had about it. So I think it's yeah, really vital.
the
So
miracle of
it's just a
life.
good.
It's the miracle of life.
Totally.
It's and without women, we there would be no babies, and the joy and that, and you know what also is, it's like that connection of the mother and the baby has. The
Mhm.
baby knows what you're thinking, you know what the baby's thinking, and the babies, too, what I noticed was, I remember after I had my daughter, my first baby, my daughter Naomi, my father-in-law, he was kidney transplant, so he was downstairs in the hospital coming back from kidney dialysis, and my mother and sister saw him, and she said, Roshan had the baby. He didn't know, and he came up and he started talking, and my I was feeding my baby, and she just looked up at him.
Oh wow.
Isn't it funny how even like the babies
Yeah.
know
Oh.
who the familiar voices and
Oh, totally. Yeah, absolutely.
uh,
Even though, yeah, they just look like the small, helpless thing. But again, like babies have their own kind of
I say they know more
self-defense
about us.
mechanisms and things that they need to do to keep
They
themselves.
probably
Yeah.
know who we like and who we don't like, and who's familiar and who's
Oh,
not.
yeah, absolutely. They have
Probably know
such a
more about.
strong, intuition and yeah, and I think that's something that we're all probably born with, but as we grow up, often we can kind of lose sight of that. But
Yeah.
yeah, it's incredible.
And just before we go, another little miracle. See, everything's coming up now. Is
Yeah.
I remember I used to wake up the exact same time that my babies woke up,
Oh.
whether they were for feeding or whether they pooped a nappy or they needed a nappy change or they had colic. A mother
Mm.
automatically, instinctively, and intuitively wakes up either just a couple of seconds before the baby. I forgot about that. See, talking to
Yeah.
you and everything back.
Yeah, it's that, yeah, the mother-baby bond, like it is
Yeah,
impenetrable, yeah.
yeah.
So obviously, yeah, we don't need
And
to
they
go
already
down
know
another
you can.
rabbit hole of talking how how terrible it can be to interrupt that, or to deny a woman or her baby that connection. But yeah, it's just, I mean, it's what makes the world go round, really. So yeah, beautiful stuff.
Well, Paula Kelleher, thank you so much for taking the time to come on and speak to us here on Confident Women Island's YouTube channel. And you're going to be on a lot more as well, because we're launching a panel discussion of women, and you're a part of that panel. And we're going to be talking more about fertility and everything to do with pregnancies, fertilities, and everything to do with women. So we'll be getting to hear and see you a lot more.
That's great. Thank you so much for having me. It was so fun chatting to
I
you.
loved it. It was like the last time we met in Dublin, we were talking for ages,
Yeah,
hours.
I know. Yeah, it's incredible. Thank you so
Thank
much.
you so much indeed.